Hey guys, how are you doing today?
Hey, Dr. Corntager, thanks for being here.
Hey, one of my partners,
I don't know if I can hear you.
Can you guys hear me?
Yeah, audio's coming through well.
Okay. One of my partners came down with COVID, even though fully vaccinated. So I had to take
Hey, Dr.
over.
Corntager, we're having trouble hearing you, but I think it's on our end. Give me one sec. Yeah. Give me one sec, we're having trouble hearing. Thank you. Yeah, I was just trying to figure out which one. Here it is. All right, Dr. Corntager, try now.
Can you hear me all right?
Yep, we can hear you loud and clear.
Okay, so listen, unfortunately, I'm going to stay on as long as I can. One of my partners who's fully vaccinated is out with COVID, and he was supposed to be covering burn. So I'm on for burn, and we'll have to go to they're going to call for the OR sometime in the near future. But I want to stay on as long as I can.
Okay, great. Well, actually, so we're just going to go ahead and do introductions. And so my name is Aaron Brake. I am the president and founding this organization, this student chapter here. And so thank you all for coming. I'm going to have Dr. Corntager introduce himself first so he can get that in before he has to leave. You want to go ahead and introduce yourself and kind of what you do and your position with the chapter, but also how you're involved in global surgery, just briefly.
Sure. So very quickly, so Richard Corntager, I'm a plastic surgeon and chair of the Department of Plastic Surgery. I've been involved so I'm the advisor for the group. I've been involved in global surgery for, oh my gosh, 25 years, probably, or a little longer. Both global as well as volunteer surgery in various places around the US. Our department is very heavily involved in global surgery. We've got a site in Guatemala that we've been going to twice a year pre-COVID, and hope to get that started again soon.
Awesome. And I'm going to hand it over to Jack.
Thanks, sir. My name is Jack Ayers. I am a third-year med student as well, and have had the opportunity to go to that hospital partner site that Dr. Corntager was talking about in Guatemala. So hopefully, once kind of the international restrictions kind of lighten up, that will become an opportunity for you all as well. So I'll turn it over to AJ for our last introduction.
Hi, everyone. My name is AJ Poreda. I'm a second-year medical student here. I have not been to Guatemala yet, so sometime hopefully in the future. And I will probably pass it on to students. So.
Oh, no. Yeah, we'll go ahead and,
I can get your deal set up here.
yeah, thank you guys for coming. Jack's much taller than I am.
Oh, yeah,
Thank you
I'll
guys
get
for
your way.
coming. And we just want to talk to you. This is a brief primer and intro into global surgery. Some of the topics, some of the important factors to think about, because before we talk about, going abroad, it's important that we talk about why and what it is, do some education on that. And that's the primary goal of this organization. So this is our first meeting, and we're really excited to talk about this with you guys. So. Oh,
Try now.
thank you. So what is global surgery? Seems obvious, but there's a quote, because there's a lot of things that people think it is that it's not. So global surgery is a field aims to improve health equity for all those who are affected by surgical conditions or who need surgical care, with a particular focus on underserved populations in countries of all income levels, as well as populations in crisis, such as those experiencing conflict, displacement, and disaster. And so that's a broad scope of what global surgery is. And so now some of the issues in global surgery are the surgical inequities. And the reason global surgery exists is because there are surgical inequities across the globe. There's about 5 billion people who lack adequate access to basic surgical care. And what we mean by that is there's what we call the bellwether procedures. There's 3: laparotomy, C-sections, and open fracture treatment. Those are kind of like essential surgeries that people need access to. And that's kind of what we qualify as basic surgical care. And 5 billion people lack that. And globally, the poorest 30% get only 6.3% of surgeries. And the richest 30% get 75% of surgeries. And that's true not only within, globally. We know that generally in each country, there's disparity between those, but it's very pronounced when you look at the world's poorest countries. And so the implications of this. So when you're talking about the outcomes, 77.2 million disability adjusted life years. And that's a kind of how epidemiologists try and lump that and make that into a value that we can measure. Kind of looking at how does the effect of neglected healthcare, lack of healthcare, affect their ability to function in years of adjusted living. And 16.9 million deaths in 2010 alone from a lack of surgery that could have been prevented with surgery. And so some of the outcomes of this, right? So individual families deeper into poverty, right? That's easy to understand, but you can also have economic on a macro level. Countries' economics start to not function well when a lot of your population can't receive adequate medical and surgical care. And you just end up with global inequities being perpetuated. The poor continue to get poorer because they can't afford to work or they can't work, etc. And so a catastrophic health expenditure. This would be roughly translated when surgical care or health expenditure exceeds a certain percentage of monthly income. Depends on what source you read, but around 10%. If it's above that, that is significantly likely to put a family into financial crisis. 32.8 million people face CHE due to receiving surgical care. So an additional 48.5 face CHE trying to access surgical care, and half the world is at risk if they were to need surgery. So if everyone were to suddenly need a surgery, right, apart from the fact that there's not enough surgeons, a lot of people couldn't even afford it, or if they could, it would put them at a severe financial crisis for their family. And just try to keep my notes up on this laptop. And so this falls primarily, this graph here shows those events stratified by income. And you can see that the red bar being the medical and non-medical costs, that's kind of the overall cost, falls significantly higher on the poorest group. And they are simultaneously the least likely to have access. So it's a double hit sort of effect. So when you're talking to someone, politicians, et cetera, right, the economy is always involved. People always like to talk about that. The $20.7 trillion lost in global economy. And that's over the course of 10 years, according to this study, or about 15 years. But 12.3 million specifically from low middle income countries, LMICs. So when you think about that, that's a lot of money. And then when you consider the fact that the countries that are losing out on those missed opportunities, those missed GDP gains, are already poorer countries, that effect is exponentially higher than if it were a wealthy country. So the WHO goals, they wanted to see 350 billion is what is needed to reach the WHO's goals. And what they meant is, at the state we're at, the level of money that's being spent to provide surgical care is inadequate to meet the basic minimum for what would be adequate global surgery. And a lot of that comes down to the economics. And so when you look at the surgeries, there's some maps, they make it very obvious, right? We can talk and put words up, but this is the proportion of population without access to surgery, adequate surgical care. And you see kind of what you maybe would have expected, but there's significant deficits, not just in the poorest countries or the typical what you think like a few countries, but a lot in Africa, but also in Eastern Europe and in India and in South America. There's also, when you look at density of surgeons per population, you see the highest densities actually, in Europe and here as well. So there's just not as many surgeons, not just access to the equipment or the money, but just number of surgeons, significantly lower in other countries, partly because of the economics and partly because the infrastructure to support the surgeons and the hospitals required for the surgeons. And so this is a slide kind of pointing out the delays to surgical care for those patients who are injured. The first delay is in seeking care. So you can think of it seeking care culturally, whether it's culturally or financially, people are hesitant to seek care, especially and pronounced in poorer communities and in more isolated communities. There's also the second delay where reaching care, physically getting somewhere, whether it's because you are in a remote village or you live in a city, but you don't have access to the other side of the city where the main hospital is, or won't accept your payments, or you just can't get there. The third being delay in receiving care. So even if you can afford, and even if they can afford care, they can get to the care center. A lot of other countries, especially the poorest, who don't have the financial support to house all these patients, to fund all the doctors needed to perform the surgeries and all of the health costs associated with that. So there's three layers when you think about the individual getting to surgical care. And that's something that a lot of us don't really take into consideration here. We maybe think, oh yeah, like rural health, someone who's far away, it'll take them a while to get there. But then there's other layers on top of that for a lot of these people in other countries without the infrastructure that we have. And why does this burden and disparity exist, right? That's kind of like the ultimate question. And they have some notes here. They want, so what do you guys, I want to hear from you. Why do you think these burdens and the disparities of surgical care in different countries exist?
Lack of resources and funding.
That's good. Any specifics? Who,
Lack of surgeons in general.
So in many of these places, it's not only a lack of surgeons, but it's also where the surgeons elect to work, where they end up. And you see this in a lot of developing nations. You know, you see it in this country as well, that surgeons will often end up working in places where they can sort of make a living. So, you know, you see a lot of the surgeons in developing nations are in the bigger cities as opposed to, you know, rural.
yeah, those are all very good points. And that's kind of what they talked about in their notes. And that's kind of what we want to point out is that, yes, there's fewer surgeons generally in these. I showed you the population density. There's also significant decrease, or there's significantly fewer the further out from these urban centers that you go from, as Dr. Corntager pointed out. There's also a lack of primary care infrastructures to support surgery, right? You think about a surgeon is not just an island to himself, right? He's part of a greater continent, if you will, of medical professionals and healthcare ancillary teams. You have to have access to follow-up care in order to provide good surgical care. You cannot just do surgeries and expect people to suddenly heal. You need people there who are going to follow up with them. If you can't follow up with them, then you need people who are experts and who can help them if you aren't able to follow up with them. That is a huge problem for some of these countries, and it's a problem here. A lot of people lack of follow-up care is a big driver of morbidity and bounce back to hospitals and poor outcomes for surgical patients and other patients as well.
And, you know, these days, I think it's also important for us to recognize and to very specifically articulate that it is also very much as it is in this country, it is a way of controlling segments of the population for the betterment economically of the dominant groups. So, you know, access to surgical care, access to medicine is a way to control your population as well. And I don't mean, you know, number in the population, but it's a way to physically control, you know, how, based on people's health and their access to care, you know, how much they can fight you, how much. So I think that's something that in this country now, we really have to, you know, we have to look at seriously as well.
Yeah, so the social aspect, the socioeconomic, the social, the political, the geopolitical framework for all this is very complex, and it varies country by country and region by region. And that's another factor that I'm not an expert in, but there's lots of papers on these things. So education, learning about this, you know, is a very important aspect of what we hope to transmit to you guys. And then one other thing was, and I think Dr. Corntager pointed this out, is deficiency numbers, but also the effect of brain drain, which is something you might have heard. Surgeons either leaving rural areas and going to major cities, or leaving the country. And you know, there's no, I would never say someone's bad for leaving a country to make a living doing surgery elsewhere, but that is in effect, and especially in some subspecialties of surgery, people will train and they will do surgery here and they're great. But there needs to be a sustainable way to train there, not just here, not just where we can have everything, kind of how Dr. Corntager pointed out, like controlling the situation. We like to have control of the training programs, but training elsewhere abroad, being able to help those who are interested to actually have the skills. And so that's another aspect of global surgery, and that's something we'll probably talk more about in the future. And so, so ultimately, we can talk about the economics. You can talk about the money. You can talk about how many lives you'll save, how many adjusted life years you'll save. But this picture, right? This is a picture of a fractured leg. They didn't get surgical fixation, and now likely will have deformed bone growth for the rest of their lives. And that should be, just the human aspect of global surgery is something that inspires a lot of people to want to do this. And so there's a humanitarian aspect, absolutely, not just economics. We're not just talking about numbers, not just talking about the dollar signs and the adjusted life years. We're talking about people and people who need adequate care, because we believe people should have access to their full potential, to what they can accomplish, and their full health if they can. And so the LCOG's goals for 2030, and I would have to, I always get mixed up with this, the Lancet Commission on Global Surgery. So the Lancet, from the academic aspect, there's a big paper we can talk about, and this summarizes a lot of it. They published a large paper on the state of global surgery, and in it there's a lot of facts. It's a long paper, and if you would like, I would highly suggest accessing that. You can either ask for it or you can find it online, I'm sure. They have a lot of these things, but here's some of the goals they set. They want, this would be ideal, 143 million additional surgeries and procedures per year. Currently we're at 313 million per year. So that would, be about a little less than half, but about that, 50% more. 5,000 procedures per 100,000 population is what they would like. 2.2 million more SAOs to reach their goal, and 80% coverage of essential surgeries and anesthesiology services by 2030. Kind of covering those main surgeries. Oh, Jack just sent the great. Those main surgeries that would meet adequate for what people need for global surgery goals. And actually, let me make sure I don't miss anything on this one. Yeah, so I would look up that paper. Jack sent it in the thing, and well, don't worry about it. You'll find the paper if you want it. I would highly recommend that. And so there's a video here. I'll just summarize it because I don't want to mess up the Google thing, how it's set up right now. So Lancet Commission on Global Surgery, by the numbers, 5 billion world population without access to safe and affordable surgical care in anesthesia, right? That's a huge number. That's almost inconceivable from where we're at here in the US. I mean, but basic surgical care, $21 trillion estimated loss in global productivity. We talked about that. 143 million additional surgical procedures needed, and then 350 billion estimated global investments needed by the end of 2030 to reach the goal, reach what we would consider adequate surgical care for people across the world. And that is kind of by the numbers, right? And so the Lancet has a lot of reach now. There's a lot of different organizations working on these sorts of things, and that's kind of where our organization has a role to play. From a global standpoint, planning, identifying stakeholders, all the data stuff, all the things we need, the background work, that's been going on, and that's going on, and work towards finding ways, practical ways, right? Analyzing the data. There's a National Surgical Forum that kind of processes these sorts of things. They highlight the things that are important, and then they go and they engage with funders, prioritize applicability, feasibility, and impact. Different surgeries have different impacts, et cetera. A lot of complicated data there. And there's long-term monitoring that needs to go on too. And so those are kind of the global aspects, right? These are kind of over our heads right now, especially we're at, education, first through fourth year, we're medical students, right? but let's see. Some of the common surgical interventions that they've come up with already, or sorry, some of the surgical models that exist already. Surgical mission, right? You've maybe heard of those. You've maybe even been on one. There's 1 to 2 week long surgical trips, specialty surgery organizations that will work within their specialty specifically, maybe send a group or maybe do education, provision of resources. So supporting a hospital abroad, right? Financially and or with resources, physical resources or otherwise. And then also there's education where we bring fellows bring surgical trainees. So to do a fellowship, for example, over from lower middle income countries and do education. And so, we can talk about, these have different roles they play, right? 1 to 2 week long surgical missions can be an important part, but they cannot be, and they shouldn't be without the ancillary support that is required to heal people after surgical care, right? So, and that's a big movement recently. You've probably heard and seen on social media decrying surgical tourism, so to speak, doing some surgeries and then leaving the patients kind of like on their own without follow-up care. But more and more we're seeing people working within a hospital system, working with an existing group of surgeons abroad or a hospital with faculty and staff. So that's a very viable thing. It's not all just medical tourism. There's definitely a role where people can take time off to go do a trip, and they know that people there are going to take care of their patients when they leave. But there's more work beyond just doing that, because it would be hard to fulfill all the required medical surgical needs across the world just doing that. And that's where some of these organizations come in.
Let me interrupt you for just a second.
Yeah.
Just from a terminology point of view, most of the time when we're talking about surgical tourism, we're actually, it's most commonly, we think about that as the person who goes to a foreign country, Mexico, South America, some places in Europe, to get procedures done, whether it's cosmetic surgery or whether it's, it can be a heart bypass, it can be anything, but it's they go there to avoid the high cost in this country. So that's just sort of terminology, but I think it's important to know that that's sort of what that's generally how that term's going to be used. What you were saying with respect to these 1 to 2 week surgical missions, that is absolutely critical, because there's a big move away from, although they still occur extremely commonly, but there's a big move away from what we used to think of or talk about as parachuting into some place and going in, and it became almost like a competition. How many surgeries could you get done in a week or in 2 weeks? The other point that you brought up, which is sorry, I'm going to have to leave to go to the OR, but the point that you were making about the follow-up. There's a general belief that we need to get away from these 1 to 2 week, or it's one thing doing 1 to 2 week, but what you really need is sort of this ongoing follow-up, and you need to develop relationships with the people on the ground, so that, the last thing you want to do, there have been cases where well-meaning physicians have gone to other countries and have killed people, have killed children as a result of these surgeries. And then if you do a surgery and they have a complication, then you can easily leave them worse off than when you started. So those are sort of really critical things. I'm going to have to sign off now, unfortunately, but one of the things I want you guys to really sort of talk about and start to think about is, what do you want this group to do? let's see if we can find what I would think of as sort of a very achievable 1-year goal, and maybe we form a stretch goal that, you know, is something that we could either achieve in a year or more than a year, but things where you can actually make a difference and you know, not, and be able to look back and say, yeah, we did something. So sorry, but I'm going to have to run up to the OR. They're calling. We need to make sure that we have this presentation in the in a folder so we can, you know, people can review it again later and we can look at it and help us plan. All right. Anybody have any, before I run, any quick questions or anything they want to ask me before I head off? Okay. Great work. And we'll see it. I'll see you guys soon. Okay. And we'll do it in person. Like to do it in person next. Thanks.
Yeah, thank you so much, Dr. Pointer. So I don't know if you realize, anyways, we are in person. But yes, so ask Dr. Yeah, talk to him. Talk to Dr. Pointer. He has a lot of great advice and stories on that sort of thing. So that's, you know, that was something that has been pushed against recently, and you've probably seen that. And then moving on to, you know, surgery organizations that are sub-focused, they have subspecialization and they want to train, they either go abroad and work with surgeons there or bring surgeons here, like the fellowships and all of those sorts of things. And then provisions of resources. And so there's a lot of aspects and a lot of ways people get involved. For you, you know, these are things to think about for your own careers. You know, if you want to do something with global surgery, there's different avenues, different longevity. There's people who go abroad and stay. I know someone who does surgery and runs a small hospital in Africa, and is their only surgeon on staff. People then on the other side of that will go join him, relieve him of some of his duties, or help him out with surgeries for a time. Okay.
Do you know where in Africa?
I know Tutukaluki, I think, is the city or the province he's in. I do not remember. He's a friend of mine's relative, actually. So hopefully that would be actually something I would like to see if you could zoom in with us sometime. That was something, and we'll talk about some of our future things that we want to try and incorporate and hear from you guys. But so that's one aspect of global surgery, but people who join him, you know, that's another aspect. Training, bring people here, train. So there's a lot of ways to get involved, and these are ways identified that have been identified by the Global Health Commission and Surgical Commission. Let me do this. And so there are international surgical teaching collaborations to teach relevant surgical procedures. They build infrastructure for surgical training programs. That's important, being surgical training abroad. Not surgical training programs, not the ones here, you know, are great, but building training programs abroad. Using local resources available to the community. When people do surgical missions or when you do surgery abroad, you hear about austere situations, austere environment, and basically learning how their community will be able to support surgery, because you cannot expect some of these communities to be able to support, you know, a giant MRI, intraoperative MRI, you know, angiography, a lot of these high-tech devices that we know we can get pretty good results, but as of right now, we need to be able to learn from them in these countries, learn tools and techniques they use, and incorporate them and build up their own training program. And sometimes that just means helping sponsor them and helping fund their training program, because they know what they have access to and they know what they don't have access to and they know what will work in their community. And then creating a bidirectional exchange of knowledge, and that's huge, right? And that's, now we're in that age where the world's becoming smaller, right? So for instance, like this Global Surgery Student Alliance is an international thing. Like we have I guess you call them sister chapters across the globe, not just in the country anymore, not just in the Midwest, but across the globe, and we collaborate on research projects and things like that. And that's an important aspect, not only at the student level, but at the higher levels of medical institutions. And so this is the sustainable approach that the Task Force on Global Surgery has been pushing for. It's focusing on the workforce shortage, but also the systems and the systems that help the workforce do their job. And so just another on the implementation of what this looks like. And this is kind of recapping a lot of what we've talked about, but the problems that need to be addressed, right? This is what global surgery looks like. These are the things that have been addressed and identified that need to be addressed. The workforce and training and education, right? So some of the most fundamental things are gaining the knowledge, not just doing surgeries. It's training how to do surgeries well in certain environments, learning how to train others how to do surgeries in certain environments, learning how to create a system that can support surgical patients. The economics and the financing of this. This is even less sexy than surgery. It's the money part. I'm not great at that, but we have people who are very good at, we need people who are good at allocating resources, identifying features in a system that need optimization, economically and financially, specifically. The world runs on money, and even though money isn't our main objective here and isn't the main focus of the topic, it's unavoidable. And understanding the economics is a huge part of global surgery. We do it for the people and the patients, but the finances and economics are a huge part of that. Information management and data monitoring, right? So you can go do a bunch of surgeries, like Dr. Korndager said. If your outcomes are worse than the condition left untreated, then you've done harm, right? That's the risk that surgery in particular runs. I mean, we have the unique privilege, surgeons, that is, have the unique privilege of performing what would be otherwise assault on people, but they have permission and society's granted them the access to perform surgery in attempts to help someone. But if surgeons are going abroad doing procedures and the outcomes are worse than before, you really have to question, you really have to question the ethics of that. And that involves data monitoring, collecting information long-term, right? That's why we need healthcare systems to monitor those outcomes, the long-term effects of these efforts. That includes research. So that's kind of where a cool opportunity people at our level can get involved. I'm trying to get research just to understand more about the effects that global surgery is having, the lacks of global surgery across the world, and then also education, research on the education side, like who's receiving education on global surgery, who isn't, who should we target more, what global surgeons or what field is lacking in global surgery. That sort of groundwork can help lay the foundation on which you can build the actual systems which can support surgeons who are going to do the surgery. And so, focusing all of this to focus on sustainability and capacity building, right? We talked about the numbers earlier. There's a lot of surgery lacking across the world. But that's not just because there's not enough people. I mean, it's part of it, but you need systems that can support that. Accessibility and capacity building, infrastructure, obviously. And then you can do all of that. You can build great hospitals. You can have great infrastructure to support surgeries. But then if people are not going to the hospitals, or if the wait time, right, or if the scheduling doesn't work right, if there's any of those three access to care problems, then it's all for naught, right? I mean, the end goal is to do surgeries, not to have hospitals that can do surgeries. And so, following through with that This is what global surgery is. It's not just surgery across the world and doing that. It's not just doing surgery, it's the infrastructure and all the background work that goes into it. And that's why it's not as simple as sending out a bunch of surgeons to go do surgeries, do however many millions of surgeries we need to do. And that's what we want to talk about this year, especially. That's what we want to instill in all trainees who are interested, is that it starts with the background knowledge, education, understanding the complex problems at hand. And so this slide's a lot. I don't know if I need to read about this. I'll read this real quick. We have no time. So the 10 needs provisions of safe surgical and anesthesia care. So these are the things, right, to do the surgeries. We've talked about the frameworks for building up the systems in place. These are the things, the specific details. You need trained surgical providers. Talked about that. You need trained anesthesia providers, which is something that often gets forgotten. You need people. If you can do surgery, you can't just do surgery on awake and feeling people. You have to have them either sedated or anesthetized, or they can't feel, right? I mean, you have to have anesthesia involved. Infrastructure, equipment, supplies to perform safe anesthesia, and the specific surgeries that are required for basic surgical access. I'm not going to read all that. Well, and also, I guess they talk about HIV, right? Electricity, water, personal protective equipment. So part of that is involved. That sounds like general medicine, and it is. And it's not even just general medicine, having access to clean water, right? You don't think about that in surgery necessarily, but you have to have this infrastructure. So it all comes with it. Decontamination and sterilization capacity, right? Otherwise, you're just going to be performing dirty surgeries and everyone will get infected and you might as well have not gone, right? So blood supply that is safe and affordable, screen and cross match. You guys will learn about that in IBI. Drugs, including antibiotics, pain meds, anesthetics, nursing care, that goes with the ancillary team, right? That goes with everyone you need to perform surgery, not just the surgeon. You need 24-hour surgical cover, right? The ability to perform and review and respond to deteriorating patients. It's not just elective cases that need acute management of traumas, et cetera, or decompensating patients. Is something that needs to be sustainable. Quality improvement processes, right? Now we're getting into some of the more infrastructure. This is once you've established things. You need to have ways of auditing a system, auditing a procedure, checking back to make sure it was performed thoroughly and carefully, and also monitoring perioperative mortality and follow-up care. And then risk assessment, operating planning for planned procedures. That's a long list, and I read it out because I think it emphasizes how complex this topic and the necessary direction and process needs to be. And so investigating, this is something there's a lot of research going into understanding how can we optimize this. Some of you might be engineers. That's sort of in that realm, like optimization, finding a system that needs optimization. But administration, some of you have goals for administrative roles, right? That's something that is super necessary. I mean, you can have all the surgeons you want, but if they don't have a good administrator, they're just going to be yelling at each other about which operative route is best for whatever. So you need to have, there's different skills that need to be involved. And then researchers to do all these sorts of studies as well, if you're interested in research. Searching around, like not just here, find people to collaborate with online. You can search other organizations, send emails to people. It'd be great if we can also set up research with our organization, but these are all options. Innovative, and this is kind of how do you solve some of these problems, creativity, approaching from multiple angles, right? So this is, the politics and politics, the political side of things is a whole different realm, right? We talked about the systems from a very like, how do you get water to this building? How do you support all these nurses, anesthesiologists? But before you can even get there, you have to convince someone that they need it. You need to convince our politicians, you need to convince politicians elsewhere that this is something worth pursuing. And that's what our organization is involved with. The Global Surgery Student Alliance and the Incision, the parent organization, are involved with political campaign and stuff like that, just to try and get access to medical care or surgical care. And then technology, et cetera. This is just emphasizing the multifaceted roles that you all can play and that we need other people besides medical people. It's not just doctors doing this. And so this is just a list. So I know a lot of you guys starting out, a lot of first years here, you know what you don't know exactly what you want to do. You might have an idea, it might change. There's plenty of global surgery fields that need filling and have specific roles, and anesthesiologists that are needed to actually perform these. So I won't read through all these. I think that's something you could find easily, but as you explore ideas, don't ever feel like you can't be involved. If you want to do global surgery, and that's something that's kind of like directing your path, you can always get involved. Or if you're kind of interested, it doesn't matter where you go, what field you go into, you can still get involved. There's a place for everyone to be involved. This is kind of a complicated, I'm not going to do the whole thing, but you know, this got cut off, I think, but injuries, and then, you know, transport injuries, one of the biggest causes of mortality and need for surgery worldwide. And that includes musculoskeletal disorders, right? So ortho, right? Big, broad. There's some surgeons here, I believe, and Jack might know more about that. Ortho surgeons who do research, they go abroad and they work with hospitals abroad. They do surgeries, but they also do research, trying to understand more about that. So that's something, if you're interested in, reach out to people. You know, I just have this on here to emphasize a lot of these that you wouldn't think need surgery actually do. You know, things like TB, tuberculosis, very common across the world, in some countries more than others. And even TB can need surgical care. So surgery is not just the obvious things, it's needed for a lot of different things. So just keep that in mind. And this is a long power slide, so I won't go this one though, about our organization. So this is a national student-run global surgery working group here in the US with sister groups abroad. It's affiliated with the International Student Surgical Network, which includes national working groups from 30 countries, right? So students across the globe affiliated with different universities or programs, all under the same. Yeah, no worries. Yeah. So the vision of the organization: sustainable and accessible surgical, obstetric, and anesthesia care worldwide. The mission is to educate, inspire, and unite students through engagement and mentorship in global surgery, including anesthesia and OB/GYN. They have a website, you can check it out. And one of the, I'll at the end, I'll go over that. So there's a little bit more about the organization. So we've just started. This is a new organization for those of you who don't know. We started this year, and we're excited to see what we can do, get as many students interested. And also, just like Dr. Korntager said, like, find a thing that we can do, not just exist and say, I'm part of this organization, and put it on a CV, right? To actually like find something we can do, whether it's a monumentous, right, like we cured global surgery, or we got involved and we were able to raise awareness for global surgery. We were able to do this or that. Find a way to get involved, and hopefully we'll be able to go forward with this new organization and try and find things that you all are interested in. I want to hear about what the student, your first and second years have and ideas you have. That's one of the things, and that's kind of what, so discussion ideas. We already know we want to educate. We want to talk about the ethics, right? So what should we do, right? The should. Economics, how should we do it? Economically, how should we do it? And then problem solving, et cetera. And then how to get involved, right? We want to talk to you guys about the future, right? I mean, you guys are getting training right now. And right now you're in the books. It doesn't feel, most of you, it doesn't feel like medicine yet, but you'll get to a point where you're actually able to take care of a patient and you'll be like, man, this is crazy. I was just learning about the TCA cycle last year or 2 years ago, but figuring out how do we get involved, either now or in residency. So I want to have people talk to us, surgeons who are abroad. If anyone knows people who they think would be a good person to talk to, reach out to us. Be like, hey, I got a family friend who's a surgeon here who does these trips, right? We just want to collect information and try and connect you guys with people who might be able to give you information. And then whatever interests you guys have, we want to talk about those. So projects you guys are interested in, talk about, you can talk to us directly, you can email us. You can have a meeting, we can have we have no formalized structure apart from our leadership. We want to find ways to become an active group, at least active in something. And so, yeah, so we hope to have speakers in the future. Dr. Corndier is a great resource, and I would love to have him talk, and I'm sure he will. He'll have great things to say and advice and information. And so there's surgeons here, there's OB-GYNs here, anesthesiologists here. We work at a huge hospital here, and a lot of people go abroad and do this sort of work. So hopefully we'll be able to get some people in here to talk to you guys so we can learn more firsthand from people who've had it firsthand in this segment. And so this is a quote, undoubtedly is within your power to contribute significantly to shaping the societies of the coming century. Youth can move the world. And this is kind of the point here is you may not be able to go do surgery right now. Trips sound great, right? Everyone's like, are we going to be able to do a surgery trip? I don't know. In the future, if Dr. Corndier or other surgeons are willing to connect with their groups abroad and would be willing to have students go, that'd be great. But really, the best thing that you can do if you want to help patients abroad and you want to do global surgery is to become a good surgeon. If that's what you do, or anesthesiologist, OB/GYN, become a good doctor, right? Because we need good doctors to do good surgeries and have good outcomes for people who need it. And so that's probably the best advice that I received from a surgeon who does global surgery. Focus on, learn and educate yourselves, try and get involved in global aspects, but also don't ever forget, you just need to be a good doctor. So that starts here when you're training, learning basic information, basic science, right? It may seem really distant from medicine, but it's part of the training. And so that's the first step. And so here's the references. And so these slides are provided and part of the global surgery group at Harvard. I don't know if they were the ones who started the US side of this thing or not, but they have a lot of great resources. There's resources online. If you go to globalsurgerystudentalliance.com, a lot of great information. And if there's any questions, I have a question back here.
Yeah, I just wanted to like talk to, but leaning towards promoting like ideas of Africa being like really forward, being the only country that needed help, and even on images of the map, it was just like show Africa and no other country, when in fact we're like going to Guatemala. So I just wanted to like talk to you about that.
Yeah, if you want to talk with me afterwards, we can. I can, yeah, feel free if you have qualms, and I will, I understand where you're coming from. These slides were provided and made for us to present, talk about the organization. So feel free to talk with me afterwards.
And maybe that should be part of our ethics discussion when we do that here, like that's one of our other like future events. I know it's not like an ethical question directly, but stemming off of there, like that's part of the issue is viewing non-US countries as like just in need of white savior, what have you, right? So yeah, I'd love to like have that be part of the discussion. Well, I appreciate you bringing that up.
Does anyone, oh, I think it turned it louder. I'm not sure. Is there any questions on the Zoom?
I think that was just. Or
Okay. Well, we got you guys done in nick of time. So thank you guys for coming. If you have any questions or want any information, reach out to us. Check out the website for Global Surgery Student Alliance. And yeah, have a good rest of your week and enjoy first year and
Thank
second
you.
year.
thanks
And other
everybody.
second years.
Thanks.
Maybe I can close this down so I can get the recording process.
Yeah.
I gotta go.